This is the mental health treatment presentation by Becky Johnson and Meredith Kober.
For our presentation, we were given the following scenario. Your niece has been diagnosed with depression and bipolar disorder. Your uncle is at his wit's end because her condition is severe, and his health insurance policy has a very high deductible before it covers any part of the inpatient care. You want to help, and you know that your niece needs inpatient treatment. What do you do?
Part of our assignment was to research 2 mental health facilities, and the first one I checked into was Cedar Crest Hospital in Belton, Texas, which is about 2 hours south of Dallas, Texas. It's a private facility and has 114 beds. I talked with Matthew Saylor, and we discussed the cost of inpatient treatment, which would include room and board, medications, and all therapy services, individual and group. If you do not have insurance, it costs about $800 a day, regardless of your age. They will take payments on that. If you do have insurance, it's based on your insurance plan fee schedule after your deductible is met. And the nice thing is with this company is that they will take payments on your deductible. The average stay is about 9 days, and insurance will pay for as long as considered a medical necessity. So you can stay pretty much as long as you want. The cost of partial outpatient treatment per day is, which includes group meetings, individual therapy with a psychologist, and lunch, and it goes from about 8 to 3:30 in the afternoon, is about $300 a day without insurance. And with insurance, it's based again on your insurance plan fee schedule after your deductible is met. My insurance is a PPO, and there's, since I'm in network, I would not require a pre-authorization, and my copay after my $2,000 deductible is met would be 20%. Next slide. There are different ages of patients that are treated here. They go from children that are the ages between 5 and above, basically. The payer mix of this facility is 1% of them are cash pay, 9% are straight Medicaid, 41% is through CHIPS, which is for children here in Texas through the Medicaid program, and 49% of the patients are just basic insurance. I talked with Matthew about some of the impacts of the Affordable Care Act on mental health services, and he said that because patients' deductibles have increased so much, some are between $5,000 and $10,000, and a patient has to meet that before their insurance kicks in, that most of their stay is paid for by their deductible. And so they usually have to come up with all of that, and thankfully this facility takes payments on deductibles, which is nice and rare. Next slide. Some of the legal ramifications here in Texas are things that are enforced. There's, if a patient is a minor or under the age of 16, they must be admitted by a legal guardian, and so they must be signed in or signed out by a legal guardian. The children cannot leave by themselves. If a patient is over the age of 18, they must admit themselves willingly unless treatment is court ordered. And they cannot leave against medical advice unless the treating doctor decides whether or not they're a threat to themselves or others. In addition, Texas state benefits, there are a few mental health facilities here in Texas. There's a long waiting list to get in, and sometimes it's capped on how many people they can see at a time. If a patient, though, is a threat to themselves and they can't get into one of these facilities, there are services that are arranged with local area hospitals when needed. You could go to one of these free mental health facilities, and you will not be turned away if you don't have insurance, and they'll accept payments for those who do have insurance, but again, there's a long wait to get in. And if you do not qualify for Medicaid, there is no other type of financial assistance offered in Texas. Next slide.
Okay, and I contacted the Utah State Hospital, which is in Provo, Utah. It's a state-run facility with 322 beds, and I spoke to Sharon Turner, and you can see a breakdown of the number of beds per age group there. The cost of inpatient treatment, which also covers room and board, medications, and all therapy services. For an adult, it's $490 per day, and for the pediatric unit, it's $780 per day. And she said the average stay in the pediatric unit is 6 months, which brings your total cost to over $140,000. And in Utah, the only state benefits available are Medicaid, but that only covers the Utah State Hospital if you're under the age of 22 or over the age of 65. And for my insurance there, I also have a PPO. I do have to require pre-authorization, or I'd have to pay a $400 penalty. And after I pay the $2,000 deductible, I have to also pay a 20% co-insurance. As far as legal and law enforcement, one thing different about the Utah State Hospital is to be admitted, you have to be referred by a local mental health agency and have a court order for civil commitment. And to get the court order, you have to meet 5 criteria, and one of those is that you are a danger to yourself or others. The payer mix for the Utah State Hospital, this was just an estimate given to me by Sharon. She said it's about 60% of the people have insurance, 20% are on Medicaid, and 20% are on Medicare. And as far as the impact of the Affordable Care Act on mental health services, she said that although the Affordable Care Act has expanded mental health coverage for families and individuals, the administrators, she says, have to jump through a lot more hoops now.
The mental health coverage with the Affordable Care Act is one of the 10 essential health services that is required for qualified health plans, which means that the mental health services and addiction treatment programs are provided to evaluate, diagnose, and treat a mental health condition or substance abuse disorder. It includes behavioral treatment, counseling, and psychotherapy, and it must comply with state or federal parity laws.
Okay, and those mental health parity laws, the word parity means equal or equality. And in 1996, Congress passed the Mental Health Parity Act, which just stated that any annual or lifetime dollar limits on mental health coverage can be no lower than the same limits on medical services for that same plan. But that act ended in 2007. So in 2008, Congress passed the Mental Health Parity and Addiction Equality Act, which built upon the original Mental Health Parity Act and also included addiction and substance abuse treatment. And it expanded on it to now the copays, deductibles, and out-of-pocket maximums have to be equal for mental health as they are for medical services. But neither of those acts required insurance plans to cover mental health services, which is what the Affordable Care Act did.
This admissions process is not required for our presentation. I just thought it was interesting to see that if you do have to be admitted into a mental health facility, these are some of the things that you'll have to encounter. You'll be initially assessed as soon as you enter, and they will evaluate you, and a plan of action will be made, and they'll work with you and the patients and your family to resolve any concerns about the process. What to bring is just a few things. You can see that you can bring shoes, but no laces. And on the next slide, it'll show you what not to bring, which includes hair care products with long cords, belts, scarves, sharp objects, things that you may use to either harm yourself or harm others are not allowed into any mental health facility.
As far as successes and difficulties, for successes for the patient, we feel a success would be the patient feels confident to leave the facility, committed to staying on their medications and seeing a therapist regularly, and that they will seek help if needed. And on the insurance side, just that the Affordable Care Act now requires mental health coverage on all qualifying health plans. And for difficulties, like we said for the Utah State Hospital, you can't just check yourself or your family member in. You must be referred by the local mental health agency and also have that court order. And in Texas, the 17-year-old is not considered an adult or a child. That means they're allowed to sign themselves in and out regardless of what their parents want, unless there was a court order or if they are a threat to themselves or others. And another difficulty would just be if patients are not being fully treated and are needing to be readmitted.
Some advice that we got from the people we interviewed were about the process of being in a mental care facility was that although they have rooms available at USH, that it can take a while for a referral. So Sharon Turner said that to get help as soon as possible from your local mental health agency, there may be a waiting list of up to 90 days to be seen by a psychiatrist. And Matthew Saylor from Cedar Crest here in Texas said, when talking about you, the patient or the family member, suggested to be open to medication changes and treatment. Don't shut down and to let the treatment work.
And then how does having a knowledge of the mental health industry apply to us in our careers as healthcare executives? Well, even though you may not work in a mental health facility, mental health needs can be identified in many situations. You may be working in a hospital or a doctor's office or a long-term care center and have patients that need mental health services. So understanding what the available treatment options are and what insurance covers is very beneficial for all healthcare administrators.
The two choices for part of the assignment was to choose one of the health facilities for our niece. And we looked at Cedar Crest, and some of the advantages were that it was a smaller facility and you could be admitted quickly. And disadvantages was that it was more expensive. Whereas the Utah State Hospital, the advantages were that it was less expensive, and disadvantages were that it would take a long time for you to get in because you need a referral and a court order. So as for our choice, even though it's more expensive for adults, we would choose the private Cedar Crest facility for our inpatient experience because of the lower amount of patients that are currently there, the smaller size of the facility, and that it's easier to get admitted and faster, which is a big consideration for inpatient services.
Okay, so the questions for the discussion board. Number 1, does your state offer any benefits other than Medicaid to help offset the high cost of inpatient mental health treatment? Number 2, what changes would you like to see in insurance coverage for mental health treatment? And 3, if this was your niece, what would you do? Which facility would you choose? And if you have any other questions for us, you can ask them also on the discussion boards. Thank you for watching our presentation.